It's the SawCast, where real people speak that real shit on real topics, and I go by the name of Stevo.
And I'm Ariel. What the fuck do y'all? Today we got a special guest, Janeisha, man. Woo! How you doing, girl?
I'm great, actually.
Okay.
Awesome.
Look really good.
Thanks,
Yeah. So I want to break down the credentials of Janeisha because she is like a top nurse, and I want everybody to understand before she starts talking. Sometimes, you want to hear people's credentials to see how skilled and knowledgeable they are. Mm-hmm. She's very knowledgeable in her field, and she's done the work. So I want to give her flowers. So Janeisha is an MSN, which is she has a Master's of Science in Nursing, period. Then she has an APRN. That means she's an advanced practice registered nurse. That allows her to independently, she don't need no doctor there. She can independently examine patients, diagnose illnesses, prescribe medications, and she can order tests in most states in the country. Mm-hmm. She's an FNPBC. That means she's a board certified family nurse practitioner, which means she is allowed to practice nursing, and she's able to access, diagnose, treat, and prescribe medications for patients of all lifespans. So sometimes, she said even kids, so sometimes you can only do certain type of I mean, you got like a specialty or something like that. Mm-hmm. She can do everybody. Mm-hmm. She's skilled in everybody.
I'm going to, but that means I have the capabilities. But that means I'm going to.
Okay.
Yeah.
Who's your focus, Janeisha?
So the reason why I got a family nurse practitioner, my background's in emergency medicine. So I've been in the ER for 10 years. So if the world ever crashed and burned to a point where I had to go back into the hospital, ER is my background. So, of course, that's where I'm going to go back. And if they wouldn't allow me to work in the ER if I had a license that was only 13 and up, because we see babies. Mm. That's the only reason why I got the FNP.
Okay.
It would not have been my choice.
So what inspired you to become a nurse practitioner?
So honestly, it was a business decision. And a lot of people be like, really? Yeah, it was a business move. So I have been in the ER for 10 years. I actually had no desire to go into entrepreneurship whatsoever. Like, it was never on my radar. My goal was to climb the corporate ladder, become the chief nursing officer of a hospital. And then I was like, yeah, I don't want to do that at all. So 5 years ago, I opened my wellness spa. And so I knew I didn't want to be bedside forever. But I said, if you're going to walk away, you got to have a plan to walk away. So that's when I found that prevention was actually more of my lane, because reactive healthcare just doesn't work. Mm-hmm. So once I started really researching and getting into it, the laws in Texas started to change a lot. And there were laws that were changing in the med spa arena that I said, I don't want to be caught red-handed just because I don't have a piece of paper. So if that means you got to sit down for a couple years to go and get your certification, then that's what you got to do. So that's why I did it.
Okay. So being in the medical field, and being a Black woman, have you ever had any difficulty, struggles, any adversity?
All the time.
What's some of your biggest adversity that you had to face, and how did you deal with it?
So being a Black woman in healthcare is very interesting, actually, because you get hit with a lot of different things from different people. So you have the patients that come at you. You have administration that comes at you. You have the doctors that come at you. You literally have every single person. And then your coworkers, because they are the biggest haters. And so being a Black woman in the healthcare space, especially being in the emergency room, a lot of times I was having to be the only person to advocate for my other Black patients. And that was always a challenge, because the providers that did not look like me did not understand why I understood what this patient was going through, instead of you just looking at them clinically and just saying that, oh, yeah, their blood pressure is high. So I had a patient actually when I was traveling, and she had a history of high blood pressure, non-compliance with her blood pressure medication, 37 years old, had already had 2 strokes, and had 3 kids at home. And the provider that did not look like me was just going to write her off because she was like, no, you need to be admitted. I mean, mind you, her blood pressure was like 200, it's like stroke level. So I understood the seriousness of her wanting to admit this lady. But when I sat down and talked, so she got pissed off and she wanted her to leave against medical advice because she said she could not stay. And so I went in and talked to her trying to figure out what was going on. Turns out the reason why the lady had not been complying with her medication is because the medication made her sleepy. And so she would have to take the medication and go to work. She had been written up several times because she was falling asleep at work. So in order for her to not lose her job to take care of her kids, she wasn't taking the blood pressure medication. She couldn't stay that day because she had to, one, work the next day, and her mother was sick and had just went into the hospital, and that's who usually cares for her kids. So it wasn't that she was just not being compliant because she didn't, like, she really had stuff going on. And she said, I promise I will come back tomorrow, but tonight, like, who is going to watch my kids? So a lot of the times I tell people, we need to see more people that look like me in the healthcare setting, because those are the type of conversations people don't understand, the struggles that we deal with as a community. And not a lot of times they can talk the same language that we talk. Like, we have our own dialect.
So instead of it just being paper, it becomes a bit more personal and understandable, right?
And so
if
me
they see
and
somebody
that,
they can
yeah.
relate to, then
and
you
me
can,
and that doctor really had toe to toe, because I'm standing toe to toe with her. Like, no, you're absolutely not going to do this. I need you to write. You know, it takes somebody to actually be like, no, this is the right thing we have to. And I've had to do that several times. Because a lot of the times we don't get the same fair treatment when we go into these healthcare settings. Mm-hmm. And it's unfortunate because we already have a target on our back. We already have stigmas that people already judge us before we even walk through the door. And so when you don't have other people that look like you when you go into those settings, it can be very scary.
Right, because you don't have nobody necessarily advocating for you. Mm-mm. Because now you're just another patient instead of actually being a person.
Yeah. And it is a double-edged sword, because the healthcare system is a really terrible system. So a lot of the times the ERs are backed up. Like, we're dealing with not a lot of nurses and doctors to really care for the patients. And so everybody on the inside is trying their hardest to see everybody, while everybody on the outside is trying to still get the care. But it's like, we can't always meet the demands that come at us because we don't have the resources. Mm-hmm. So a lot of times people don't see that side too. So I see both sides. It's not a win for anybody, honestly, unfortunately.
And so, like, what other ways have you seen Black women being treated unfairly in the healthcare field or in your field?
There are a lot of disparities that come with Black women when it comes to maternal health. Mm-hmm. There's a lot of disparities that is just with just being Black in general, because a lot of the times, a lot of Black individuals don't have the education that they need to get the care that they need.
Love that you
and
said
it's
that.
not
it's my favorite
necessarily
thing.
From them. It could be family members. It could be generation of things. Mm-hmm. And then you have other individuals who have had unfavorable experiences in the past. So they already feel very like, ooh, I'm not going to do it. So I make it a point to make sure that, one, yes, I'm educating on the things that need to be educated on, but making it make sense. Like, I'm not going to talk to you at a high level with all this medical jargon. I need you to understand the importance, because a lot of Black individuals don't understand. Sometimes, yes, y'all still do need to take your medication. Like, it's not a system that, oh, well, I'm just going to do everything the holistic way. Like, sometimes you need meds, okay? You can't holistic and out herb a genetic history. Like, you can't do it. So it doesn't mean it's a forever thing or it's a stigma, but sometimes if you want to be here and live a life that you can actually enjoy, sometimes you got to take some medication. There's nothing wrong with that.
Right,
just
even if
take
it's temporary.
them, please. Even if it's temporary, but just take them, please.
Right.
A lot of people fight me on that. And a lot of people are like, oh, you just feel like you just want to just push medications down our throat. I'm like, no, I went into functional and integrative medicine for a reason, because I know the system of conventional medicine doesn't work. I understand that. But I also understand that there are reasons that we do need you to have the medications.
No, for sure.
And we need you to take them. That's always the thing.
I've seen that so many times in my life with like the black people in my life. Just even the younger people who have to take medication. I don't know what the aversion is to that, but
Trauma.
trauma. Yeah.
It's just trauma. Yeah.
Trauma and trust.
It is, and
Trauma and trust.
a lot of the times they have come from the same era of things. There are a lot of people that even before I was a nurse practitioner that I walk into the room and they automatically like, oh my gosh, here you go with all of this. Like, you know, I'm like, girl, like, hey, how are you? Like, let's start there. But they've had traumatic experiences and they're just like, no, I don't want it. I'm like, you don't even know what I'm coming in here to say. Like, you came to me for a reason. So, you know, being in the ER trenches for 10 years, I've learned a lot, I've seen a lot, I've done a lot, and now I know what I don't want to do.
Okay.
Yeah.
You can talk, about the bill. Yeah.
Oh, okay. Shoot, I can go into that.
Yeah.
So Trump's big, beautiful bill, it had reclassified nurse practitioners as a non-professional degree. It's supposed to slash the loans they're allowed to receive in half, and it's going to make it increasingly difficult for black and brown people to get to be into your position that you're in right now. Why do you think NPs was in that group of to be changed into a non-professional?
So there are two things that go into this thing, which on the happier side, there has been a lawsuit to temporarily stop this. An injunction has been filed to temporarily halt it, which is good. But the reason why they make it seem like this is going to be so great and why people don't understand the detriment that this has, people don't understand the health disparities that we're facing right now. Healthcare in this country is awful. Okay, let's just call a spade a spade. It's really bad. And so not even talking about the rural counties. I mean, just people who live near facilities where they can go to a hospital. A lot of people in this country don't have good insurance, if they even have it at all. And so a lot of the times now that we're dealing with a system where individuals are more chronically sick now than they've ever been before, our obesity levels are through the roof, including pediatric obesity levels, and people are sicker now than they've ever been. So we don't have enough providers as it is to even care for these people. And I mean like providers like doctors. Like there's not enough doctors available to care for the sickness in this country. That's where mid-level providers like nurse practitioners and physician assistants come in to kind of bridge that gap. Not even talking about rural areas, because that's a whole nother ball game. But when you don't have the amount of providers that is necessary to care for these people, this is where you get the backups, because everybody floods into the ER. No matter if you have insurance, you don't have insurance, if you don't have a primary care doctor, everybody floods the emergency room. So because more and more people don't have health insurance, where are they going? Into the ERs. So now you have a system of more people coming into the system with not enough people to care for them. So if I only work on a shift, we work with one doctor, 2 or 3 mid-level providers. I can walk into a shift and there's 30 people waiting in the emergency room, and that's at a small ER.
Sheesh.
So you want 30 people that's checking in, plus the 55 people that's already in the back, plus the ambulances that are still coming through the door. So at any moment, I got 75 people that's supposed to be responsible and seen by 3 people. How does that work? And that comes with the resources that we don't have when it comes to staffing ratios and paying people. Like, that's a whole thing in itself. But that bill is going to make it almost impossible for people to really get the care that they actually need, because now you're not going to have more providers coming into the system to fill the gap. So then what's going to happen? People just going to be sick and at home and waiting until they're on their deathbed before they either die or go into the ER where it's almost too late. So hopefully the injunction that has been filed will allow that to not pass, because if that does happen, it is going to be harder for individuals to afford to go to school. So if I can't afford to go to school, I know how much my student loans are. So if I can't afford to go to school to get their credentialing and get the education to be able to help in the system, then what happens?
Yep.
Because the doctors are just older.
Yeah.
The doctors that are coming in, they're still new. They still got to learn. There's a lot of seasoned doctors, nurses, nurse practitioners. The system has drove them completely away from the bedside.
Wow.
So even the ones that are there, they're tired of the unfair treatment, the low wages. They don't want to deal with that system. So they go out on their own. So then you have now more providers that are leaving the bedside even as it is because they don't want to deal with the system. So then who you left with?
Yeah. I also think that just because of the administration that we have out here, that they're trying to target nurse practitioners because nurse practitioners are the most, from what I've researched, you can correct me if I'm wrong because you're a big MP, but the sexual reproduction and stuff like that in the health of a person, MPs know a lot about that, and they are like the most skilled at teaching others about that. Doctors more so like are ready to just diagnose you and then get out, but an NP sits there with you and will talk to you and help you get through stuff like that.
And there's two folds to that. So we always say as a nurse, you have the curative side, you have the curative side. So doctors are the curative side. They're looking at the clinical picture. They're seeing like, okay, they got these labs going on. Okay, we need to fix this, diagnose them, boom, they get them out the door. Versus the nurse on the other side, we're more of the curative side. So we're looking at the full picture, including the person. Yeah, we're looking at the clinical diagnosis and seeing what's going on, but we're also looking at the person too. And a lot of the times that part gets missed. And on top of that, majority of nurses, there are only 8% of nurse practitioners that are Black. Majority of the nurse practitioners are females. So, of course, we lead a little bit different when it comes to the care and the sexual reproduction and women's health and women's wellness because a lot of the people that are in that field are women. So, of course, we're going to talk at it at a different level. And so that's why it was such a big deal. Even though it was a business decision for me to go back to school, getting my credentials as a nurse practitioner and becoming a provider, it hit a little different. Because one, I am one of the 8%. So saying all of these nurse practitioners and you are one of a very few thousand that are Black. And so seeing and understanding, like there's that meme that's going around, like when your patient comes in the room and they see that you're another Black individual, like that's a real thing. Like people have gotten excited when I walked in the room, they like, okay, girl, like they feel that comfort, like we can talk, you understand what's going on with me, I can be open and I can have conversations. The doctor come in, they be like, they ain't say that to me. Oh, I know. They weren't going to say that to you. So it does cause a strain. And a lot of people, I have friends that are in school right now, and if they weren't registered by July 1st, they were going to lose that funding because now it's like I'm enrolled in the program already. So now you're telling me I'm going to lose the funding for me to even finish the program?
Yeah. Make sure
that was a huge thing.
Wow.
The majority of those professions are women professions. And a lot of those professions take women from one class to the next. So they're trying to prevent women from going one class to the next and being more lenient on men. They don't want us to learn about sexual reproductive health, of course, because that's what MPs teach. That's an area
that's a
like they
even
run you guys even run like Planned Parenthoods and like just like female clinics and things like that. MP can run that whole clinic without a doctor.
We can, but the reason is that because we don't the way the system is just so it's systems. It is cheaper to pay a nurse practitioner in those roles than to bring in a medical doctor.
Okay.
So a lot of the times they prefer to have, so like Texas, we're not a independent state. So that means that I still need the oversight of a medical doctor because Texas is not independent. So even though I am able to do these things on my own, I still have to have an overseer. So in those spaces, they can easily have 3 nurse practitioners working and only 1 doctor to oversee them. So they're only having to pay 1 doctor salary and 3 nurse practitioner salaries. It still saves them on the bottom line. And so it's unfortunate, but a lot of the changes that have happened now within the healthcare, I've seen it, where they are pushing out a lot of the doctors to bring in younger physicians because, one, they can pay them less. Now they're paying based on your acuity, what type of procedures that you're doing in-house, and then they're making your salary based on those things called RVUs now. So now they want younger providers. They want to pay you based on what you do because it's going to save on their bottom line. And then we can also bring in mid-levels too because we can pay them less.
Okay. So
That makes so much sense.
being a part of that 8%, and then, you know, you had to be a high performer to be a nurse practitioner, right? And I know part of your mission is to help high performing women strive and not just survive. So why is a part of your focus on high performing women?
So one, myself, I am a high achieving woman.
Yeah,
For
absolutely.
sure.
So
Absolutely.
it's really seeing what I needed for myself when I have it. That's really where that came from. But I feel like it's very unfair for society to have these societal norms that they place on women. And I feel like women are the only individuals that society makes us have to choose. That I either have to have my career, you have to be a mom, where you can't have both. And I feel like it's unfair. I have always been a team too much person. Okay, that's just been my personality my whole life. So why do I have to choose? And I'm an only child. So I wanted to be able to have both. Why do I have to choose if I'm going to be a mom, if I'm going to have a career, if I'm going to run a business? Like, why does society tell me I can only do one of these things? And so I feel like a lot of women over the years that I have come in contact with have experienced this as well. And so a lot of the times, no one has ever sat anybody down and any woman and said, it's okay for you to rest without the guilt. It's okay for you to understand that you can do it all, but you don't have to do it all. And I experienced burnout myself. And I know a lot of women were coming to me and asking me questions like, how do you do all of these things and stay balanced? It was a question I was getting so often that it made me really have to say, well, Janeisha, how do you do it all? And so I tell people all the time, because a coach told me, like, when you look at a scale and when there's balance, that means no movement. So if I'm really going to be balanced, that means I'm not moving, I'm not doing nothing. So how can I still do all these things and thrive and not just feel like I'm just getting by? And so that is where the nervous system regulation came into play, because that wasn't something that I was formally trained in undergrad. I wasn't formally trained with that in MP school, but it is a huge part that is missing from both men and women, honestly, but women especially, because I'm preparing for the next phase of my life when it comes to kids, when it comes to wife life, when it comes to building my brands. And I want to still be able to do it. I shouldn't have to say, well, I've worked so hard to get my business to this point and I have to give it all away because now I'm going to enter mommyhood. I don't feel like that's fair. So how is it that I can help other women by even just using me and using my story, that you can still do it all, but you don't have to follow societal norms in order to do it?
You know, I think that's so important now more than ever, because it's more successful women out here, right? You guys have increased, you know, your financial prowess at a level that, especially in the Black community, that the men have not, you know, caught up to. Right. I would say. So that's definitely important, and especially for the Black community, for them to see you guys, right? And then with you being out there in the community and you being a successful businesswoman, then it's like, oh, now they have something to look up to, especially being in the field with only 8%.
Right.
So can you tell us about the Fibroid Room and how it got started?
Yes.
Yay.
So actually, all of these things, the nervous system regulation, the Fibroid Room, all of this came to me like out of just nowhere. Okay. It was just God speaking to me, I guess. That's what it was. And so when I decided to share my story of me having, so in 2025, I had a myomectomy, which means they removed fibroids out of my uterus and I kept my uterus. And so I had 22 fibroids removed, grade 2 endometriosis, and an ovarian cyst removed from my uterus. And so I documented the story. I did not know what I was going to do with it, but I just knew I wanted to document it. I didn't know how it was going to look. what was going to come out from it, showing my pictures of my fibroid babies. I didn't know what that was going to mean. But I shared it one day on IG, and my DM was flooded with women who was like, oh my gosh, I've had that too. Oh my gosh, I didn't know that was a thing. There were so many people that were sending me messages, and I was just like, so there's not enough conversations being had around fibroids, endometriosis, reproductive health, PMDD. Like, there's not enough conversation. So I said, what better way to start the conversation than you be the one to start it? So out of a whim, so July is Fibroid Awareness Month.
Mm-hmm.
So I decided during Fibroid Awareness Month, I was going to have an event called the Fibroid Room. And so I brought together my OB-GYN who did my procedure. I also started my acupuncture journey before I had my myomectomy, because I was originally thinking I was going to heal my fibroids myself and help shrink them and do all those things. What a journey that was. So I started doing acupuncture. So I brought these women together to sit and have a conversation with other Black women, because these are conversations we were never meant to have. My family has been plagued with fibroids. My mother, my grandmother, every woman in my family except for maybe 2 women have had fibroids at some point. And so these are conversations, these are generational traumas that are being passed down that we don't have a space to talk about it. So I was just like, well, I guess you're just going to create it. And so here we are,
amazing.
here too.
Wow.
Nah, that's dope.
How does it go last year?
Last year was really good. I really did not know what to expect.
Mm-hmm.
I felt like I tried to bring in all the pieces.
Mm-hmm.
I wanted to have, the OB-GYN, the acupuncturist, the therapist, the physical therapist, the pelvic floor therapist, a nutritionist, she's a dietitian, and a chef that can cook foods to help women to understand what this means to eat for your body. And so I brought all the things together. There were things that I'm like, okay, I could have did this better. So this year I implemented those things that I'm like,
awesome.
you could have did these better. So I implemented that. I actually wasn't going to do it this year.
Why?
Because with school and I had boards and I just
Yeah.
felt like it was just going to be so much for me to do. But then a lady sent me a DM and told me that she actually, because she attended the event last year, she got connected with my OB-GYN doctor, and she was having her surgery 2 weeks later. And so I was just like, okay, I guess we're going to do it.
Yeah.
So
amazing.
we're here again.
That's amazing.
So it is now my annual event, and it's just going to get bigger.
When is it?
So it's going to be July 26th in the Design District here in Dallas. So we're going to have the panel.
Let me get my ticket, because
tomorrow's
I got them too.
Tomorrow's the last day for early bird tickets.
Okay.
But
Better get that.
we are we're bringing the panel. So my OB-GYN, she's going to be there again this year. My acupuncturist is going to be there again this year. I'm bringing in a registered dietitian this year, and I'm also going to have the therapist, because people think that it's a fibro room and I'm only talking about fibroids. That is a huge part of the conversation, but the womb wellness is a big piece that a lot of people miss. And a lot of women don't understand that we carry a lot of trauma in our wombs. And in order for you to heal, whether it's to get rid of the fibroids, whether it's having the myomectomy, whether it's having a hysterectomy, whatever it may be that you're experiencing, there are hormonal imbalances that are in there, and there's womb wellness that's in there too. And those are conversations that we need to have, because I didn't even realize how much trauma you carry in your womb as a woman until I went to acupuncture. And she was just like, Janeisha, you have to let this go. And I was just like, well, girl, I'm fine. And she was just like, no. Wow. Like, you have to, one, release the traumas that you're carrying in your womb. And a lot of the times, because we as women, we have cycles every single month, and we're like, oh my God, I'm dreading this thing. But you don't understand those conversations that you're having. They're creating traumas within your own womb. So then when you try to want to conceive, your womb is telling a different story that you've been telling it for years. And those are conversations that we don't have enough for women to understand. It's all connected.
Yeah.
And we don't have it enough.
Right.
So
other than like treatment, are there like any other ways to like lessen the effects of fibroids or?
So unfortunately, we don't have a clear pinpoint reason that says this is the reason why fibroids happen. We just know based on providers that have, that work on them, we have an idea of some things that could be culprits.
Okay.
And so every woman has a different story. And so a lot of the times environmental factors play a part in it. What we eat and how we eat plays a role in it. Caffeine is a huge predictor of it. Obesity, so the weight, there are more people, like I said, America is the fattest it's ever been. And so metabolic inconsistencies, hormonal imbalances, all of these play a role in these fibroids. And so I can't say that there's something that you can do to prevent them, but there are things that you can do to help to mitigate them so they don't get as bad.
Okay.
So when I first found out that I was diagnosed with fibroids, I only had 4. By the time I got to my surgery 4 years later, it was 22. So I know there were things in my life that I did that created a breeding ground for these fibroids. And so understanding those things, I'm like, I can help other women to understand these are things that they need to do so that your symptoms don't. I wasn't symptomatic, but I wasn't symptomatic because I was on birth control. So there are a lot of things that we teach is a wait and watch. And, there's not a problem, then we won't do anything until it becomes a problem. Mm-hmm. That is how that model and that system works. Instead of, well, they're not a problem, but let's do some things so that they don't become a problem. I want that to be more of the conversation.
Right.
Yeah.
And what are some of those things that you want that they could do so it don't become a problem?
So that it doesn't become a problem. So a huge thing is weight management. Weight management is a huge part of that because when you have metabolic dysfunction in the body, that already sends signals through the body that has all these hormonal imbalances. So making sure that you're at a healthy weight, that's always going to be number one. Caffeine intake, like people love coffee, okay? I was drinking 2 energy drinks a shift, so I get it. But the caffeine makes those fibroids, it just creates that ground where they just want to like, oh, I love this. Yes, we're going to keep going. Stress is a huge factor when it comes to the fibroids. And a lot of Black women are just chronically stressed. And so it's hard because it's one of those things that you really have to fix it because when your body is stressed and people think that, mentally, no, I'm fine, I can function, but they don't understand your body is stressed out. Mm-hmm. And the more your body is stressed out, the harder it is for your organs to function like they need to. And so that just creates a breeding ground. And then the foods that we eat. Like we gotta let go of these inflammatory foods that we eat because guess what? They just cause they're a breeding ground for the fibroids to just continue oh, I love this. The sugars, oh, I love this. Like you create the grounds for them. So they just be like, yeah, we posted up, we chilling. We like it here. So what's the point? So those are the things that for me, I would have liked to be educated on. Because even as a nurse, like I had no idea. I didn't know what things I could have done 4 years prior to prevent my fibroids from getting so bad. It was predetermined for me because of my family history. Like that was probably always going to be a thing for me. Mm-hmm. But just because it is in my family history, there were things that I could have done to be like, well, let's kind of work on these things. So even though even though they still may have been there, but they may not have gotten to a point where they tripled.
Right. It wouldn't have been 22.
It wouldn't have been 22. And in my defense, there could have been, because there were some smaller fibroids behind the larger ones, when we did the ultrasound and we only saw 4 and then 9, it could have been more. The ultrasound doesn't tell you exactly how many is there. So a lot of those I feel like we're probably hiding behind the other ones because I have the picture. So there were a lot of smaller ones behind the larger ones and we just didn't know it.
Okay. And I know that 80% of Black women will have fibroids before the age of 50. Mm-hmm. Yeah. So I guess you already kind of answered this. I was going to say why the number's so high because you already answered it. Basically like stress, really. Mm-hmm. I feel like that's a big thing.
That's a huge.
Is there any other things you might think?
Stress.
Just Black women in particular? Okay.
The stress and the foods that we eat. And I mean, when I look at the population of Black Americans in general, we lead in heart disease for a reason. Mm-hmm. And because we lead in heart disease, it makes me be like, well, why is that? And a lot of the times it's because
stress and weight don't mix.
They don't.
And bad food. Like,
it
that's
don't.
all
Like we
that.
love to eat. Like that is culturally, Like, that is a bonding thing for us.
It is.
Facts.
And so even the good foods that, you know, are probably good for you, like greens are good for you. I said this other day, like greens are really good for you. But y'all put the ham hocks in there.
Oh,
And
yep.
so, you know, then you take this amazing vegetable and now you have added all this other salt and sodium that it didn't need. Okay?
Mm-hmm.
Put a little, you know, that ain't my thing, but.
This is a question that I want to know. Do you think that hysterectomies are recommended for Black women a little bit more than others?
So,
or are they sometimes the best option?
I feel like it is very situational.
Okay.
So I feel like when it comes to Black women's health, a lot of the times the recommendations that are given to her is because of the provider that she has. And I've had this conversation with my own doctor on why this has happened. And she has had a lot of people that have come to her, and they are coming to her as a second opinion because that was the very first option that they recommended. A lot of women don't even know that myomectomies are even an option.
But I know with myomectomies, the fibroids come back.
They can.
That's
It is not a foolproof thing.
Okay.
That is true.
Yeah.
So with a myomectomy, yes, the fibroids can come back because the only way to 100% guarantee that they never come back is with a hysterectomy.
Okay.
So for some women, they do need that. But that doesn't mean, like for me, I haven't had children yet, and that is something that I desire. So a hysterectomy would mean that I would not have the option to have kids. And so for some providers, depending on how they practice, of course they're gonna be like, yeah, go ahead. We'll just do a hysterectomy, and then, you know, you won't ever have to worry about the problem again. But then it takes away her options. And so there's even I can never think. There's another option that you can use as well. But a lot of women just don't know the options on what's available. So I do feel like it is offered depending on who your provider is.
Yeah, I think also severity probably too.
And it is a thing. There are some women that you absolutely, like, you are bleeding to a point where your hemoglobin is dropping to that was my mama's story. Like, her hemoglobin was at a 5.
Same.
And so in certain situations, that may be the thing. But for my mom, she wasn't going to have any more kids. Like, she was like, I'm done. So if that's what got to happen, then cool. But I don't feel like you should offer that without giving a woman all of her options.
Right.
And there are some people and some individuals who that is the best option for them. Yes. But at least give her the option to be able to choose what she wants to do instead of just saying, no, this is the only option you have.
Well, when I went to see my doctor, she said myomectomy wasn't. She said if I have it, I need to hurry up and get pregnant.
Yeah, that's. I mean,
you're gonna have to do it in, or they gonna come back.
Yeah.
So you know,
it depends on how it really depends on what
it's a lot to think about.
Body is, because I was very hesitant to have my myomectomy myself.
Yeah, that's a big surgery.
It was a big surgery, but it was more of my doctor told me that once I had the myomectomy, I would only have to have kids via C-section.
Oh, okay.
And I was like, I don't want that. But she was like, the goal is the healthy pregnancy. Like, that's the goal. And so it is a uterine fibroid embolization. That's what I was trying to think of. But a lot of people don't even know that that's an option. It is not an option for everyone, no. But at least you have the option of a UFE, a myomectomy. And yes, my doctor does the same thing. Like, okay, girl, it's time. Like, what we doing? We need to get these kids in here, because that's always the chance. But that's why understanding. That's why working on my stress levels, making sure I'm eating low inflammatory foods, making sure that I'm doing the things to prevent what I would have wanted to do before. That's why that's so important for me to know.
What are some symptoms that you see from women, like that? Probably some adverse symptoms of fibroids that you see.
So usually, a lot of times, what we see is like heavier cycles. That's usually one of the main symptoms that we see.
Which probably what causes a drop in iron and
it can if you're bleeding. It depends on how severe you're bleeding.
Okay.
Because some women, you shouldn't. It is not normal. And when I say this, people are like, "Well, what do you mean?" It is not normal for you to bleed like you are being slaughtered, and for you to be in uncomfortable, debilitating pain every single month. That is not normal. And it has been normalized by a lot of individuals and a lot of families that this is just what happens when your period comes.
PMDD.
That's not normal.
That's what they tell us.
Yeah, that's not normal. Well, they say that now, but that wasn't even a thing before.
Well, yeah.
Yeah. But that's not a normal thing.
My mom came up with that. She said, I think it's the PMDD.
Yeah. So a lot of the
I don't
times,
know, girl.
women have this thought process. Like now, since I've had my myomectomy, I have no symptoms during my cycle whatsoever. A lot of the times, I have no idea that she's going to show up if it wasn't for an app. Like I say, nothing. No cramp, no bloating, no dysfunction, no tenderness, nothing. If it wasn't for an app, I would not have known that my period was coming until she show up.
Wow.
So we've normalized this because this is what, Black women's suffrage. Like this is a thing that we're supposed to suffer.
Like
and you're supposed to be a strong Black woman.
Yep.
Like why? No, that's not normal.
We be thinking it's normal, I promise.
That's not. It's not normal. My doctor is the worst that told me, said, Janeisha, that is not normal. So if you're bleeding like that, where you're saturating multiple pads and going through tampons in 30 minutes to an hour, that's a problem. You need to go and see an OB-GYN. You need to go have a ultrasound done, preferably one that is not the most comfortable, but you need a transvaginal ultrasound. That's the only way that you're really going to know what's going on. And that is the one test that I would love to be a part of more preventative conversations. But because if more women had more transvaginal ultrasounds done when they go and get their yearly or every 2 years pap smears, I feel like we would catch a lot of these things a lot earlier.
Do we need to go in there and ask them?
So the thing is with ultrasounds, it's the cost. That's always, everything comes back to the cost. It is not a test that, an ultrasound is expensive. And so it's not something that an insurance program is going to want to just cover just because you just want one. They want a reason for you to have to get the test done in order for them to say, yeah, we'll pay for it. And that's the problem. Yeah. That's why preventative wellness is not a part of just everyday conversations, because insurances don't want to pay for those things. So it is a thing that is definitely on my... I had the same conversation with OB-GYNs, with fertility doctors. Like that is a thing that if more women would get transvaginal ultrasounds earlier, we could probably prevent a lot of the things that happened later on in her life, because we know what we're up against. So when the fibroid is the size of a dime versus the size of a watermelon, I can do a lot more with the size of a dime versus, it was a conversation on Threads the other day where a woman posted her fibroid, and it was the size of like a small melon. And she was just sitting with that, having terrible bleeding, pain every single month. She can't go to work. It really disrupts people's lives. And then you have businesses that don't understand what's going on with a woman every month. So then they just think that, oh, you're just being lazy or you're not being productive at work. And it's like, no, my insides are literally about to fall out. Like they are falling out, or like my hormones are so out of whack. I can't sit here and function because I ain't got the mental capacity to focus because I don't even have enough hormones that's circulating. Like it is a real thing, and society just thinks like, oh, that's just normal for you. That's just what's supposed to happen.
Yep.
No, okay. Well, I want y'all to sit here and see what we really have to deal with, because it is really biologic what goes on in our bodies every single month. And people don't understand, like, there's a difference on when you're functioning, when your estrogen levels are at peak. I feel amazing. I can do all the things. I can think clearly. And when it's in the toilet, the same thing with menopause. Like, people don't understand there are biological things that are going on in a woman's body, and y'all just sit here and just think that, oh, you just don't want to do it. No, I really just cannot.
Yeah.
And there's a difference.
Wow.
It's debilitating sometimes.
So with so many years of Black women being misdiagnosed and they're losing trust in the medical field, how can, you as a healthcare professional, as a nurse practitioner, how do you think like that relationship could be mended?
So I told people that I don't take the weight of those conversations on, because I know me and I would want to try to save everybody. I do feel like a lot of providers that are in that space of women's wellness, and we have that authority and that trust when it comes to when the patients that we see on a daily basis, like we have to take that responsibility serious. A lot of the times, and I can't always blame it on the providers, because like in primary care, for example, the system is set up that the patient comes in and they have all of these questions and they want all of these things, but you only have like a 15 or 30-minute window to get all your treatments done. So it makes it hard for the provider to try to give you the care that you need, because in order for me to get paid and keep my lights on and have a good living, I have to see so many patients in a day. So I feel like that is why a lot of providers are moving to the direct primary care route, because it gives them the autonomy to be able to actually sit down and have conversations with patients and be able to spend an hour and a half having a conversation, understanding what's going on, answer your questions that you're not going to get in a traditional primary setting. And so the unfortunate part is a lot of the times the direct primary care role is not always insurance based. And so it's getting people to understand, and a lot of times in order for me to give you the best care that I can, the insurance is not going to pay for that, because they tell me how long I have with you. And if you have so many diagnoses, then I have to give you so many diagnosis codes. And then if I have to write you so many medications, I have to bill you for that. So the system is set up for people to fail. That's why I don't take insurance in my practice. And people don't understand it. I have to tell them my initial assessments with every single person that comes to my door is always an hour off top. Because I'm going through everything. I'm going through your health history. I'm going through your family history. I'm going through your sleep. What is your stress looking like? How are you pooping? Are you pooping every day? Like, these are conversations that I have the time to sit and do, because I'm not pressured by an insurance company telling me I got to see 18 to 20 patients in a day. That's asinine to me. That makes me burn out, because now I have to keep up with all of these people. Now I have to create all these orders, do all these charts, send all these referrals. Like, that is a lot. Versus I can control and see maybe 7 to 10 patients. And then they may not all be initial assessments the very first day. So I feel like the responsibility comes when you are interacting with those people, and it's having that self-awareness. I knew when it was time for me to leave the ER, because I knew that I no longer enjoy this. I'm not going to continue to, and I would never treated any of my patients unfair. I just knew me, I couldn't do this anymore. So you have to have that awareness of, is this something that I really still enjoy, or do I need to do something different? Because the moment that patient chooses you as that provider and they are coming to you to sit down in a vulnerable situation, that is the responsibility that you have to them. So I'm always going to be very transparent. I am going to listen to you, but I'm also not going to sugarcoat either. And there are times that people come into my office and I tell people, please stop lying to your providers, okay? Because we're going to find out anyway. Whether what you say or what your lab say, we're going to find out the truth. But you have to be honest, and that's why I love the movement that we're in, that a lot more Black women are wanting to seek out Black providers, because we want to be cared for the people that look like us. Mm-hmm. But on the flip side, because a lot more people and a lot more Black women are seeking out these Black providers, y'all got to give us some grace sometimes, okay? My OB doctor, her wait list is like 3 to 6 months sometimes. And I tell people she's worth the wait. It may take you a minute. I may go into her office and my appointment time, I may get in there, but it may take her an hour to come into me. I'm not sitting there tripping about that. But there are a lot of people that give these we don't give the grace. Like, well, my appointment was at 3:30 and it is 3:45 and I haven't been seen. Okay, but when she comes into the room, guess what? She's sitting in here with me at least 45 minutes, because, girl, we talking. We're talking about all the things that I need to talk. We're going to do my exam too, but we talking. Mm-hmm. Because that's how you build that rapport and that's how you build that relationship. So I feel like, you know, we got to give the providers that are actually doing the work some grace, please. Yeah. Because I see every single day on social media, somebody is ripping these providers a new one. And I'm like, y'all just don't understand the system behind it. It's not that they're saying they want to run 20 minutes late. Sometimes they may have an emergency that comes up. And people just be like, there are providers that go into work sick, that they just lost a loved one, that they are dealing with their own stressors, but they have to show up for you, and then you don't give them the same grace.
I think a part of that is when you're providing a service for somebody, right? The people never think about the other people you're providing that service for. Everybody thinks about me, right?
Yes.
So I think that's a part of it, like, because even being in IT, it still kind of feels that way. Like when I have certain people that I gotta solve problems for, they're forgetting that I have these other people that I'm solving problems for too, and they're like, nah, my problem is the most important
thing.
But I also feel like in healthcare it's a little bit different, only because people's
it's
lives
different for
is in. Sometimes they probably feel like it's more in danger than it is. Like, I can even think about us, like, we're doing IT, so when they come to us a problem, they think the world is gonna die. I'm like, this is a computer,
right? You be
like,
right.
even though I do IT
sure.
in the lab, in the hospital, we're just doing tests, like, and they be like, oh my God, everything's like, I can just imagine, like, your patient.
Right.
We get
when they actually
oh my God,
Lord,
they're
I want my
bleeding.
diagnosis right now,
Listen,
please.
I tell people all the time when I would work in triage and people would come in and they come in for something and I'm like, are you breathing? Yes. Okay, well, the patient that we're intubating back there is not. So unfortunately, you have to wait because you're breathing, walking, and talking, and I got 3 people back there that are not. And so when you put that into perspective for people, I still have people that be like, okay, was there somebody else that can see me? And I'm like, wow. No, there's not actually, because I don't have the resources in the back for anybody else to come up here and see you, because they're all tied up on the people that are not breathing. And so I tell people all the time, like, America is probably the most selfish country.
No, for sure.
Ever.
Absolutely.
Even when I go to different countries and they shout, if they shout out America, they're like, no, just, I went to one place and they was like, shout out Indiana, shout out Texas. They wanted to do it individually, even though they was announcing them by country.
Yeah.
Like, they're so selfish, and it's just so embarrassing sometimes being around them. Anyways, last question. What impact do you want to have on your community when it's all said and done?
So I have this thing my boyfriend talked about, and we got it from somewhere. I don't know where we got it from. But it was to live the dash. And so we all know when we're going to be born. We never know when we're going to leave. But living the dash is my goal. And so I tell people, I was just having this conversation today. I tell people all the time, eudaimonia is my passion, but the regulated woman is my purpose. Because being in healthcare has always been a passion. I've always wanted to help people out. That did change a little bit as I became a nurse. But I've always wanted to help people in some shape, form, or fashion. And so when I decided to go into preventative wellness, I knew that I wanted to help them in a different way, that I didn't see other people. There are not people that look like me in a preventative, functional, integrative space.
For sure.
And so to me, that's a whole nother level of a responsibility, because the education has to be there, but I also know the attacks are going to come too, because people are going to look at a little black girl like me and be like, what are you doing talking about things like that?
Well, when you open your mouth, I don't think so.
Yeah, but I already get it online though.
Really?
Oh yeah.
Online. Online is
a different ball game, but that's still the attacks that are going to come.
Yeah.
And so it's just preparing for that, because the higher you elevate, there's always going to be somebody that's going to be trying to tear you down at some point. So you got to quiet the noise. But for me, educating people and to see more individual, because I actually had to have a shift in my mindset about how I wanted to operate in my brand. And it was a personal shift that I had to sit there and be like, well, dang, like, you really had a warped sense of thinking because it was what you saw. But it doesn't mean that has to be what you create. And so for me, living that dash is really meaning making that impact, because I know that there are communities of people that look like me that need me. And it doesn't mean that they have to come into my treatment room to receive treatment from me. It could be just them learning about what nervous system regulation is and helping to examine their lives and decide that they want to do something different. I was talking the other day about neuroplasticity, and understanding that just because you've always done the things that you've always done doesn't mean that it always has to be that way. The more experiences you have, the more interactions you have, your brain will rewire itself into a completely different thing. And so we have the free will to learn as much as we want to read as many books as we want to. And a lot of times we don't take that opportunity because there's a lot of knowledge out here in the world if you just pick up a book. Okay. Mm-hmm. And a lot of the times we get so caught up in the circus of our everyday lives that we don't really take the opportunity to be like, is this who the person I am right now? Is this the person that I want to be? And I really had to say, like, you get to be somebody that you never even imagined. That I don't even know the person that I am becoming, like what she looks like. But I know, like, wow. So it's a little scary in there. It is a little scary. But I get the opportunity to be like, I get to create a life that for my children and my grandkids that I didn't have. And I didn't have a terrible life. But I get to create a new world where their societal norms are not the same as mine. And these are conversations that I have with my mom all the time. Because I tell her, like, girl, there's some people in the family that they going to be mad at some of the things that I do and the ways that I want to raise my children because it's different than theirs. And my family members are heavy in the church. And it doesn't, having those conversations about God and spirituality is going to be a different level than what my grandparents and my great-grandparents may have known. But that doesn't mean I have to always go just because that's what the family has always done. And so understanding what your passions are and understanding what the purpose is and why you're here, living that dash for me is just creating a completely new version of myself that I didn't even know existed. So what I am able to do with that, I honestly can't even tell you what it's going to be. But I honestly know that where I see myself is on stages, writing the books, creating the webinars, doing those things. I tell people, I'm like, I want to be the Tony Robbins, but with Black Girl Magic, because the impact that he has, I want the impact, but I want it my way.
And it's a SawCast.
It's a SawCast.
Thank you guys. Like, share, subscribe. Janeisha, thank you for being here.
Appreciate you for sure.
This was good. Thank you.
And we'll see you guys in 2 weeks. Bye.